So you have been scheduled to do urodynamic testing. What's next? Urodynamic testing helps to evaluate the function of your bladder. Sometimes we like to compare urodynamics to the EKG of your bladder. The preparation for the test is easy. You do not need to fast. Make sure you take your medications as you usually do. If you're taking overreactive bladder medications, talk to your doctor before the testing to see if he or she would like you to continue taking these medications or stop certain amount of days before the testing. So what to expect when you arrive for your procedure? On the day of the procedure, when you check in the office, they will ask you to empty your bladder and bring you to the urodynamics room. You will be asked to undress from the waist down and placed on a special procedure chair that has an opening under your bum. In some cases, procedure such as cystoscopy or looking inside of your bladder is added on the same day. Cystoscope is the instrument that we use to look inside, and it looks like a little tube, like very thin tube with a camera at the end that goes inside of the urethra, and we can see inside of your bladder to evaluate for possible growth or tumors or any abnormalities in the bladder wall. In that case, the nurse actually will put some numbing medication in your urethra and will make you wait for a little bit until the anesthesia starts working. So after cystoscopy is completed, your bladder will be emptied with the small catheters, and then we will start preparing you for urodynamics. We use a very thin catheter with the sensor at the end that goes inside of your bladder. Another catheter is inserted in the vagina that will be measuring the changes in the pressure in the bladder, changes in abdominal pressure. And we use a few leads that's similar to EKG leads that has some sensors on that. We place those leads over the skin to evaluate pelvic floor function. When everything is attached and set, we're going to start the study. During the procedure, we also will fill your bladder with the contrast fluid to imitate the normal filling of your bladder. This fluid is actually a contrast fluid, meaning that if we take an X-ray of your bladder during the study, we can actually see the contour of your bladder. And you're going to start feeling a little bit more sensation in your bladder, like it slowly starts filling up. I will ask you to cough, to bear down, to kind of do a stress test to see if your bladder leaks while you're doing it. I'm looking to a certain points in your bladder function. For example, the first sensation when you feel like your bladder is filling up, you don't really want to go to pee, but if there were a bathroom next by, you would use it. The second point that I'm looking for is first desire, meaning you're feeling like you need to use a restroom, but if you have to postpone your urination, you still can. And the third point is strong desire, where you really need to go to use the bathroom. But at that point, we will still continue filling up your bladder because it's a very crucial point in evaluation of the function of your bladder wall. And at some point when you feel okay, all jokes aside, I can't hold it anymore, we will actually stop filling. And we will ask you to empty your bladder right there, right then. During your emptying phase, we will also take pictures with X-ray and we will monitor the changes in the pressure. When you empty your bladder, if you still have some urine left, when we take the catheter out, we will ask you to try to empty your bladder completely and we'll measure how much is left behind, which is also very important, the function of your bladder in the pelvic floor. Once the study is complete, we will give you time to get cleaned up, dressed, and we'll have a discussion about the findings of the study. The procedure can take anywhere between half an hour and an hour. It depends how much fluid your bladder can hold. In terms of discomfort, this study is very easily tolerated by majority of people. The catheters are extremely small and there is just some minor discomfort. Some patients might describe discomfort as a little burning when the catheter goes in, but while it's in, you might feel something is inside, but it should not cause any pain. Some people ask, can I have this study done while under anesthesia? And unfortunately, no, because it's very important to get your feedback and evaluate what you're feeling during different processes of bladder filling and emptying. There's certain things to keep in mind. It's normal to feel a little bit of irritation and discomfort when you go to the bathroom the first day after the procedure. But if those symptoms persist, make sure to call your doctor's office because you might be developing urinary tract infection. It's not common, but it happens because it's still instrumentation and the catheters involved during the urodynamic study. If you notice any spotting or bleeding, do not panic, it also can happen. But if it persists, again, call your office. Urodynamic studies might sound intimidating, but it's actually not. And it's very important study in finding out how to better address your pelvic floor conditions, such as overactive bladder, stress incontinence, and pelvic floor dysfunction.